afternoon, dear colleagues. My name is Anastasia Lapshyna. I'm aesthetic doctor working with brands of aesthetics in MELINE for more than 10 years. Today, we are going to discuss with you really very interesting topic because we will talk about MELINE products. This is really a very unique and effective brand because here we have the products for different types of hyperpigmentation, for different phototypes of the skin. So today we are going to discuss really very effective protocols, how to use it, what are the main advantages and peculiarities of the products and the brand. If you have any questions, you can send it to me in chat, because after the presentation we will discuss everything with you. I will answer your questions. So now let's start with the brand. And as I've already mentioned, MELINE is really unique because its concept. Because the concept of MELINE is to have the product for the treatment of different kind of hyperpigmentation. So it's really very differentiative approach. The second advantage of the brand is that, and why it's so effective, that is because in all the products of MELINE, we have active ingredients that will influence all the processes, all the steps of melanogenesis. So as you can see here, we will influence the pre-synthesis of pigment. So we will start to work with the process of melanogenesis even before the synthesis of pigment melanin. Then we will influence it during the synthesis of the pigment, and even after the synthesis of pigment, when we already have pigmented keratinocytes, we have effective ingredients in order to lighten the skin. So the whole range of the products and the system of MELINE, I usually say that it's the system because you have specific steps. It's not just professional treatment, or it's not just home care. This is all together. It's really very easy to understand how to work with that because you have specific colors on all the packages of MELINE, and also you have specific numbers. So as you can see here, the products for the professional use will always have this red line on the package. I will show it later. And the products for the home care always will have the gray line. Also, we have specific numbers from 00 to 05, and it also will help you to understand on what step of the treatment you should use it. So 00 is the product for the preparation of the skin before professional treatment. 01 are all the products for professional treatment that can be peelings or mesotherapy, or the products which we will use to finish the treatment, like regenerative and creams for restoration. 02 is the second step of the treatment, but as you can see, it's already gray. So 02 products our patients will use at home. And this is also the products which contain acids. So every peeling has its specific product for home use, specific 02. 03 would be the products for the regeneration and restoration of the skin, which the patients will use after the treatment at home. 04 are specific BB creams with filters, so it's a sun protection. And 05 is the product which we need for the maintenance of the treatment, especially we use it in the case of really severe hyperpigmentation. So let's start with the products. And of course, every treatment, every professional treatment will start with the cleansing of the face. So here in MELINE, for that purpose, we have MELINE Gentle Foam, which is a very, very soft cleanser, let's say, very gentle foam. I also use it not only in the cases of treatment when I'm gonna have the treatment of hyperpigmentation. I also use it for the patients with really very sensitive skin, because you can see, according to the active ingredients that has gentle foam, it's dexpanthenol, bisabolol, and combination of other active ingredients like zinc, magnesium, copper. This is really a great product for the hydration of the skin. It has some anti-inflammatory effects. It calms the skin. It also has the antioxidant effect. That is why if you have patients with really dry, flaky skin, sensitive skin, hypersensitive skin, who needs very sensitive cleansing, then gentle foam would be a really great option for you. So let's see what kind of products we have and in what cases we are going to use them. So first of all, I would like to start with the products which we are going to use in the case of melasma. And for that purpose, we have two options, depending on the phototype of the patient with whom you are working. The first one is Caucasian skin, 01. That we are going to use for the phototypes from 1 to 3rd or sometimes even 4 phototype that is possible to use. In the case of ethnic skin, in the case of phototypes 4, 5, 6, it is recommended to use MELINE ethnic skin. For both of these professional peelings, we need to prepare the skin. And for that purpose, we have product 00 MELINE Prep. So this is the unique product only for ethnic skin and Caucasian skin. For other peelings, you will not need it. This is the product which we are going to use for the effect of the repolarization of the skin. It means that before the treatment, we are going to prepare the skin due to lowering down the pH of the skin. In this case, the effect of the peeling that we will apply after will be very, very gentle. So the skin will not react with the with the redness, for example, or erythema or some burning sensations, because we are preparing that with the 00 Prep. Here you can see the active ingredients of 00 Prep. We have here lactobionic acid, lactic acid, ferulic, teoxtic, and also nonapeptide 1. So also pay attention. It's very easy with this to work, let's say, with this presentation, because we explain to you all the active ingredients with the colors. So you can see and understand to what step of melanogenesis or with what step of melanogenesis we are going to work with this or that ingredient. And again, you can see that all ingredients will influence all the steps of melanogenesis. So the product is really very gentle because it has not very high concentrations of the acids, and also it has nonapeptide 1. Nonapeptide 1 is the other name of it. It's also melanostatin 5. And this is the peptide which blocks the process of melanogenesis even before it starts. So it will block the receptors which are located on the melanocytes. And in this way, for example, the hormones which are stimulated melanogenesis will not be able to sit on that receptors. That is why this step is very effective, and we will apply it before the treatment. So talking about melasma and chloasma, we understand that this is the those type of the hyperpigmentation which usually affects frontal area, cheeks area. Usually it's symmetric, and most of the cases happen during some kind of hormonal disbalance. So mainly the first manifestation of melasma can be, for example, during or after pregnancy, during the period of lactation, during the menopause period, in the case of the intake of oral contraceptives. And in that case, we are going to use or Caucasian skin for 1 to 4 phototype, or ethnic skin from 4 to 6 phototype. So as for the Caucasian skin, here you can see professional peeling, which is 01 Caucasian skin, and you can see on the package a red line, which means that you are going to use it in the clinic. And the second step of the treatment would be 02 Caucasian skin day and night, that patient will use at home. Here already you can see a gray line on the package. So 01 Caucasian skin, it's like an yellow emulsion. So actually it's like a mask, which contains azelaic acid, tranexamic acid, arbutin-coic acid, lactobionic acid, retinol, and resorcinol. Again, you can see with the help of the colors that we are gonna affect all the steps of melanogenesis starting even before the synthesis of pigment. So after professional treatment, I will explain you, of course, the protocol. After professional treatment, we have to recommend to our patient to use at home day serum and night cream. There are also some peculiarities in using of this product because both of these products are based on the acids. So pay attention to the active ingredients of the day serum. Mandelic acid 10%, phytic acid 10%, coic acid, glutathione, lactobionic acid. So we understand that this is not like very gentle product. This is very active product. This is actually the treatment of the hyperpigmentation. And we also have active ingredients in night cream, which also some acids like azelaic acid, arbutin, magnesium sulfate, thioctic sulfate, and so on. So here you can see all the active ingredients. So how it works? Often I'm receiving questions like, okay, is it possible to do professional treatment 0-1 and then not to use this home treatment day or night? Or is it possible to use to do professional treatment and then to use just day serum or just night cream? So the answer is that, of course, it's better not to do that because this is the system. The active ingredients that we have in the peeling, that we have in the 0-2 Caucasian skin night and skin day are very different. That's why if you are not using one of them, you are losing part of the effect. Because the main effect, for example, of day, pay attention here, would be the ingredients which will influence the hyperpigmentation that is already exist. So it will help to remove the superficial layers of the skin. It will also, with the help of some antioxidant activity and anti-inflammatory activity, will help to lighten a bit the pigmentation which already exists. And night, we mostly need in order to prevent hyperpigmentation in future, because again, here we have melanostatin 5 that will block the synthesis of pigment. That is why these are completely different products, and we didn't evaluate the efficacy of the products when you are using them, like not all of them. Another very important thing that have to understand doctor and that has to understand patient, that it's not possible to treat hyperpigmentation without home treatment. Unfortunately, it's like that. Because, you know, when we are doing, for example, some anti-aging treatments, we are doing peeling or mesotherapy or something else. And of course, we are recommending product for the home care. But obviously, yes, it's better, but I can't say that this is something obligatory, that we cannot work with that. We can. In the case of hyperpigmentation, unfortunately, we can't work without that. Because any peeling that we are doing, it's always chemical burn, controlled, but chemical burn. So it means that we are going to have really good results even after peeling, even after professional treatment. But this is some kind of trigger for the melanocytes. So our melanocytes understand that there is a burn, there is some kind of inflammation. So in a very short period, this melanocyte will be activated again, and it will start to produce more pigment. This is actually the reasons why we have so many patients who are coming to us and saying, you know, I've did so many treatments, I've gone to a lot of doctors, yeah, it helps a bit, but then I have this problem again. So the main issue is that the patient doesn't understand why he needs to use home treatment, and they don't use it, actually. So in the case, like it's my recommendation, in the case when the patient, you explain, but the patient doesn't understand why he has to do both, to buy products for home, to do professional treatment. The explanation is about the activation of the melanocyte. And if the patient is not ready to do both steps, professional treatment and home care, or home treatment, because it's not care, it's actually a treatment, then it's better to explain that, it would be more correct if we will do with you just home treatment without peeling, because it will depress, it will slow down the activity of the melanocytes, it will slow down and stop and block the process of melanogenesis. It will not work as quickly as peeling, of course, but this is slowly. But on the other hand, this is really a good way of treatment, because we are not stimulating our melanocyte. We are just depressing its activity. But of course, the best recommendation and the idea of the whole system of MELINE is to use and to do professional treatment and then to continue with the home treatment. Professional treatment, we will do around, let's say, 2-4 treatments, and that's all. After that, we need months to continue with the home treatment. That is why home treatment is actually 75% of the success. As for how we are gonna recommend how to use it, I will also explain it to you. Let's see the protocol of the professional treatment. So first of all, when the patient is coming for MELINE 01 Caucasian skin, we are gonna cleanse the skin, then we degrease the skin. Please don't confuse 00 prep with the degreasing. It's completely different steps. Degreasing we need in order to remove all the sebum from the superficial layers of the skin. It will give the opportunity for the peeling not to be neutralized just in the superficial layers in the skin because of the sebum. It will give the opportunity to penetrate. 00 prep, which we will use after degreasing, is not the degreasing, it's just the preparation of the skin, it's the repolarization of the skin, it's the lowering down of the pH of the skin in order to give the opportunity for the peeling to be more, or for our skin to accept it in a more mild way, in a more gentle way, because already we low down the pH of the skin a bit. After that, we are going to apply 01 Caucasian skin. For the whole face, we need around 2-3 grams of the product. We don't need like a thick layer of the mask. No, it should be the average layer of the mask, about 3 grams for all the face, without working in the periorbital area, because for periorbital area, we have another specific product. And we can apply several layers. So usually I'm applying one layer just with the fan brush, or also you can do it just in the hands, in gloves with the massage movements. You're applying that, and in 15 minutes you can apply the second layer on the whole face, like a thin layer on the whole face, or just in the problematic areas. And I also usually use some massage technique in order to let peeling penetrate deeper. And then we need a specific time of exposure. So for how long we are going to keep peeling on the skin. And this is actually crucial about this peeling. Everything depends on the time. So here you can see the average time. Like the first session would be 30 minutes, the second session would be 45 minutes, and third session we can do around 30 minutes. But this is the average protocol. This is something that of course you have to keep in mind and to understand like with what you can start. But then when you will work with this peeling more, when you will see the reaction of the skin, you will understand that of course there would be certain patients with whom you can work not for 30 or 45 minutes. You can work for 1 hour without any problem. And actually 1 hour is the time which I'm using mostly with Caucasian skin, with phototypes 1-3. I don't want to give you here on webinar some off-label protocols because they also exist when we increase the time really for a long time. But this is something that we are usually discuss on our offline trainings, because here you have really to deal, you have to understand, is the skin suitable for using this time of exposure. So for you, just to start, you can keep in mind 30 minutes, between 30 minutes and 1 hour. That would be the average time of exposure of the peeling. After 30 minutes or 45 minutes or 1 hour, we have to wash it off. So we are washing off the peeling with water and MELINE gentle foam. And after that, we have to finish the treatment. For finishing the treatment, we are using MELINE 03. We are using MELINE Moist. Also, you can see on the professional product red line, it will be 01 because we use it for professional purposes. And this bottle is 250 milliliters. For the patients, we have the same product, but already that would be 03 Moist with a gray line here, which is smaller. So that would be 30 milliliters for the home care that the patient will continue to use at home. Let's see the video with the protocol of treatment. It's actually very easy. So first we start with a cleansing of the face with MELINE gentle foam. Then we will dry the skin. Degrease the skin. For that, you can use spray degreasing solution from Anastasia in order to remove sebum. So degreasing is really very important step. Sometimes you are not seeing the effect of the peeling. It's penetrating not evenly in different layers. It's not penetrating as deeply as we expect. It's not as effective as we expect, just because there is sebum on the surface of the skin, which doesn't let the peeling to work like it should. Then we have 00 prep that we can apply with a cotton swab. Or also you can apply it with a fan brush. It's not a problem. These products we can apply in several layers. So you will see according to the reaction of the skin. Sometimes if the skin is damaged, it's very gentle. Already during the application of 00 prep, patients feel some burning sensation. You can see some redness. That means that 1 layer will be enough. But for example, with this patient, she really doesn't have sensitive skin, so she's very comfortable. That is why with her, we can apply several layers, up to 3 layers, to prepare the skin. And 00 prep, we do not wash off. So it just stays on the skin for 3 minutes until the skin will be dry. After that, we can start with 01 Caucasian skin. So we will apply Caucasian skin with a fan brush, with the hands. It's up to you. I can't say that the brush which I'm using here is like the best size for this peeling, but you can apply like this. It's very easy. with a more or less thin layer. So you don't need here like a very thick layer. Maybe you can do it thicker in the really problematic areas. For the patient, usually it's very comfortable. So mainly, patients will say that they feel some sensation of warm or maybe a bit of burning sensation, but not more than 5 minutes. And that's all. After that, they don't feel anything. They feel very comfortable. In 15 minutes, you can apply second layer or all of the face or just for the problematic areas. As you can see, there is no some significant redness. Sometimes you will see that there is no like reaction of skin at all. So it's very comfortable for the patient. And if you will do it not longer than 1 hour, then it's really very comfortable. The process of regeneration, exfoliation, everything will be very comfortable for the patient. Of course, with this peeling, you will never obtain frost. So like you don't wait for that. Also, don't be afraid of that because it will not happen. It doesn't give frosting. This patient, for example, she has some acne lesions. So I also can mention that this is the great peeling for the anti-inflammatory properties. In the case if you have some acne lesions, it will also help a lot because you saw the active ingredients. So azelaic acid, mandelic acid really will be very effective. So you can improve the quality of skin in the case of some lesions also. So some massage movements in order to stimulate the penetration. Then we waited for 1 hour. And in 1 hour, we are washing that off with MELINE gentle foam. During process of washing, of course, the pH of the skin after applying peeling would be very low. And now we are applying water and gentle foam when the pH is higher. So of course there would be a certain reaction of the skin, like patients can say, I feel burning, maybe even more significant than during peeling. That's fine. That would be just for 5 minutes. Also there can be some redness. Here we don't see because the skin of the patient is not sensitive at all. Also we are doing with her a lot of peelings, so the skin is like prepared. That's why normally you will see the reaction like this without any redness. I also can say that just after the treatment, the day which you did peeling, the skin will be really glowing. The skin will look really nice. So if your patient has something like important where they need to go, they need to be social that day, that's not problem because it gives even like lifting effect. The exfoliation or the peeling effect will start approximately by the end of the second day. So the exfoliation will start from the middle part of the face, from the perioral area, from the chin area. So normally these are all nasolabial folds. These are normally mimic active areas. We will start, so the exfoliation will start from here and then it will go to lateral parts. For the finishing of the treatment, as you can see, first of all, like you have two products for the finishing the treatment. There is an option to use both of them, like you can see in the video. First, we apply Restore, which is the regenerative cream because it has the ability to penetrate deeper. And then for the occlusion, I'm applying Moist, which contains hyaluronic acid of the high concentration. So it will stay in the more superficial layers to give us the effect like the occlusion, to also to prevent transepidermal water loss. And in the end, we are using BB, which we have two colors, which is really very nice. So you can use more light one, you can use medium one. This is the protection of the skin from the UVA, UVB radiation. And this is also some kind of BB like makeup. So patients really love it. And these are the products which we are recommending patients to use at home: 02 Caucasian skin and night and day. And also for the regeneration and restoration of the skin, 03 Restore and Moist, which are 30 milliliters. So how we will recommend to use step 2, like 02 Caucasian skin, night and day. Usually during the first week, when we have the reaction of the skin after the peeling, when we have some kind of irritation of the skin, some kind of exfoliation, I don't start and I don't recommend to use 02 night and day. I recommend to start to use them more or less 5th day or in a week, depending on the regeneration of the skin. So in a week, your patient can start to use it. And you saw the active ingredients, so we understand that there are a lot of acids there, and of course, patients will not be able to use it every day. Most of the patients, maybe just the patients with the hyperkeratosis, with the really oily skin, opened pores, for them that will be okay to use in the morning and in the evening every day. But for most of the patients, no. That's why I'm telling you are using day and night, for example, Monday. The next time you are using that Wednesday. Tuesday we are not using, Thursday we are not using, and again then we are using Friday. You evaluate the situation. So of course there can be some reaction of the skin. If it's just light erythema, if it's just light sense, like exfoliation, flaky skin, that's okay, because we have a hydration, we have the regeneration and restoration with Restore and Moist, which the patient has to use every day. But in the case when patients say that, I'm using that 3 or 4 times a week and I have like all the time, not burning, but warm sensations. All the time I have erythema, very dry skin, flaky skin, started the exfoliation, like active exfoliation again, then reduce a bit the usage of the product. So then the patient will use it 2 times a week, for example. So that's how it works. And those products for the home treatment, your patient will use for 2 months minimum. Then, as for the, let's say, general protocol of treatment, so we did one treatment. When we will do the next one? The interval between the treatments would be from 2 weeks to 1 month. So actually, when I'm working really with melasma, when I understand that we are going to have around 4 treatments or 5 treatments, I don't do it once a month. I'm doing that once in 2 weeks because I want to finish everything during the winter period, during the period without active sun, and so on. So 2 weeks interval is okay for the patient. So usually during this time, there is a good regeneration of the skin. There is no significant downtime, so everything is really fine. During these 2 weeks, patient is already using home products, as I explained. But before the peelings, 2 days before the peelings, they do not have to use 02 Caucasian skin day or night. These are the results of the clinical trials which were conducted with Caucasian skin, but these are the results of 2 treatments with the usage of 2 treatments with the interval of months, and then there was the first treatment and also the usage during 2 months of 02 Caucasian skin day and night. So you can see that the results are really very good. What else I would like to add? So as for the treatment of melasma, you saw that really is possible to get very good results. We have much more pictures that we are using for our offline trainings. Also, I'm sure there are a lot of doctors who are watching now, and you also have really great results. This is very, very popular product all over the world. So in any case, you are getting really significant improvement. But it's not that for 100% of cases, you will get the perfect result just after doing this peeling 3 sessions during 1 year, and that's all. And then never your patient will do anything again. So unfortunately, hyperpigmentation or melasma is some kind of issue, cosmetological issue that we have to deal for several years. Also, there would be patients who will have to deal with that all year life, but the only way to treat it is always to have home treatment. So to have some lightening products. So here, in the case of really severe melasma, the good result is that when patient doesn't have already to do professional treatments, peelings, lasers, they're just having their home treatment for several months during the year. They have sun protection and they maintain their result. But without doing, it's like alopecia, or it's like working with the cellulitis. It's not the effect that we are gonna have for the whole life. We have to maintain it, and we have to use really good products for home treatment in order to inactivate melanocytes, for them not to produce really a lot of pigment. As for the ethnic skin, actually the idea of ethnic skin would be the same as I've explained about Caucasian skin. These are the products for the whole face for the treatment of melasma and chloasma for the patients of 4 to 6 phototypes. Here we again have chemical peel, ethnic day serum, ethnic night cream, but the active ingredients would be a bit different. So mostly here we are focused on the antioxidant and anti-inflammatory activity. Also, all the active ingredients are more soft and mild, because we understand that in the case of the patients with the more dark phototypes, we always have a risk of the complications. So here we need to be very soft, not to be aggressive during the treatment. That's why here we have a little bit another active ingredients, which would be focused on the lightening effect due to the antioxidant efficacy and anti-inflammatory efficacy. The same is with ethnic skin, day and night. Here, mostly there are ingredients with antioxidant activity, very, very low concentrations of salicylic acid, which we need for the desquamation, gentle acids like pyruvic acid or phenylalanine, which we need for the production of the more light pigment, which is phenylalanine, for example. Also here in the skin night, again, there would be more gentle acids with a lower concentration, more gentle active ingredients in order to work completely, to have really safe work with the patients. As for the treatment, again, that would be completely same. The only difference, because remember, I've mentioned that in the case when we are working with the Caucasian skin, there are some offline protocols when we are using the peeling for a longer time when it's recommended, when we really can get more significant exfoliation and so on. With the case of ethnic skin, with the phototypes 4-6, I don't recommend you to increase the time of exposure. So here it's better to start with 30 minutes and to work not longer than 45 minutes. So here any type of aggression is really can be dangerous. So it can really cause some kind of post-inflammatory complications. That's why in the case of ethnic skin, please use the protocol which is recommended from 30 minutes to 45 minutes. All the protocols would be the same, starting from the gentle cleansing, degreasing, then using 0-0 prep, which will be the same for both for ethnic skin and Caucasian skin. Then we are applying mask. We wash it off after 30 or 45 minutes with water and gentle foam, and we are finishing the treatment with the moist. So you can see which really great results we can obtain after 2-3 sessions of ethnic skin, but of course, in the case of using of home products. I also can mention that actually you are getting really great results on the first step when you are doing professional treatment, even when the patient even didn't start to use home treatment. But it doesn't mean that he doesn't have to use that. So this is crucial, because after that, if we are not starting to use acids at home, the melanocyte will be activated. So there is a high risk that this hyperpigmentation will come back. Also pay attention to the quality of skin. I always say that if you're having ethnic skin or Caucasian skin in your clinic, believe me, you will not treat just hyperpigmentation with that, because the quality of skin, due to these active ingredients, anti-inflammatory properties, resorcinol, the different kinds of retinol, different forms of retinol, will give you a significant improvement of the quality of skin. So you also obtaining anti-aging effect, and you're working with acne lesions, like you can see here, because the effect really will be very visible also for the quality of skin. So these were two professional peelings that we are using in the case of melasma and chloasma. The other options which you can use for different kinds of hyperpigmentation would be 01 MELINE ID. MELINE means intradermal, so that means that we will use this product for the with the help of transdermal delivery. So we can use it, for example, with microneedling or with mesotherapy techniques. What is the advantage of ID? So first of all, pay attention again to the active ingredients. Here we have ascorbic acid, niacinamide, glutathione, tranexamic, magnesium. So you will get the effect of antioxidant effect, inhibition of the plasminogen, and inactivation of the tyrosinase, which is responsible for the transformation of the amino acid tyrosin into eumelanine due to all the chemical steps of the transformation. For me, what is the main advantage? So first of all, you know that working with the hyperpigmentation, we usually evaluate the depth of the pigment. Is it very superficial? Is it deep? But of course, mostly we are working with the mixed hyperpigmentation. It's not just epidermal, or it's not just dermal. Usually some part of the pigment is located more superficially and some part of the pigment is located more deeply. You also can see it from the results which you are obtaining. You're doing peeling, and normally which kind of effect do you see? It's not like all the spot is becoming lighter and disappear. No, you can see that inside the spot you can see more light regions and more dark. Some are going faster, some are staying. That's because we are mostly influenced the superficial layers where the pigment is located, and it's very difficult to work with the deep hyperpigmentation and dermal hyperpigmentation. But in the case when we are using ID, we have the possibility to use, for example, microneedling. So we can apply it on the depths of 1 millimeter to 2 millimeters, or you can use it with the needle, depending on the regulations in your country, how you can use that product. I'm using mesotherapy technique, so I can just insert the product in the dermal layer. So that's why I really prefer to do that in the case of mixed or dermal hyperpigmentation. Also, this is the great option to use for the patients during summer or active sun period. So if you know, as far as I understand, here there are doctors from different countries, and the situation, let's say, with the patients and with the weather and with the responsibility of the patient is completely different. There are countries where the patients are really very, very accurate, and they are using sun protection several times a day, necessary quantity, and so on. And there are products who never will use it. So this is the great option to use instead of peelings in the case you are not sure that your patients will really follow all your instructions, will really avoid sun, active sun, will really use sun protection, and so on. It's completely wrong, of course, because to discuss treatment of hyperpigmentation without proper sun protection from the beginning is not correct. But this is our reality. So that's why this is also an option to use during active sun, because the photosensitivity which we are getting after doing peeling and after mesotherapy are completely different. That's why mesotherapy would be really more safe. Also, for me, it's like an option for the patients who already came with the hyperpigmentation that they got after doing peeling. So if they have post-peeling complications, they did, I don't know, maybe TCA or something, some laser treatment, and they got hyperpigmentation. Usually those patients are really negative about any peelings. They don't want to do any to use any acids. So in that case, it can be really a good option to use MELINE ID, but mostly I use it, of course, in the combination with Caucasian skin. So you can do, for example, you can perform all your 3 or 4 sessions, which you think it's necessary for your patients, depending on the severity and the depth of the hyperpigmentation. And like the second step, you can work with MELINE 01 because you already see where you have really good results with the more superficial hyperpigmentation and where there are spots which you need to work more deeply. Also, you can do 01 ID between the sessions of Caucasian skin. That also would be completely fine. That's not a problem in that. As for the region, like where we will apply it, you can apply it all over the face. And this is actually the recommendation. I don't recommend to open the ampule and to use it just in the small spot somewhere on the face, because you need to get that specific dosage that we have in one ampule. You have the effect not just in the inhibition of melanogenesis. Of course, you have really good result as for the quality of skin, really great antioxidant effect. That's why for me, MELINE ID is also like, like a booster for the skin. You are giving ascorbic acid, which is antioxidant cofactor of the synthesis of collagen, which gives you glowing effect, glutathione, which is the strongest antioxidants which we can use. So it's better to use it all over the face. It is recommended 1 week interval between the sessions. So the session would be like we cleanse the skin with a gentle foam, then we are using chlorhexidine, for example, for disinfect the skin, and then we apply MELINE 01 ID with mesotherapy techniques or with devices for intradermal application, which you are using like microneedling and so on. At the end, we again disinfect the skin, we cleansing. I usually don't cleanse. I just finish the treatment with the MELINE Moist or Restore in order to soothe the skin and in order to stimulate the regenerative properties. So that was working with melasma and chloasma. And the other products which we have, like MELINE spots is the product for the treatment of solar lentigos. This is completely other issue. So it's not the same hyperpigmentation as melasma. We've already discussed that the main cause of melasma is usually hormonal disbalance. In the case of spots, this is usually the sun damage. So mainly we have spots on the areas which are prone to sun exposure, like face, shoulders, hands, for example, also décolleté. And this is like in the case of spots, we have more deep hyperpigmentation. So mainly that would be the dermal problem. That is why here we need a bit different approach. So if in the case of Caucasian and ethnic skin, we were managing and slowing down the process of melanogenesis, here we will damage the melanocyte because we are working just on the very small spot. We are not working with the whole face. That's why working deeper, obtaining frosting, damaging some melanocytes in the area where we are working will give us much greater results and much faster results, of course. So let's see how it works. Here we have our 01 spots professional peeling, which consists of two steps. Step 1 is in the bottle. It's liquid and contains azelaic acid, tranexamic acid, and resorcinol. And step 2, which is pyruvic acid and salicylic acid. Step 2, which is in the jar, look like violet pasta, I would say. So it's not a cream, it's not liquid, it's really like pasta. So the protocol, of course, we have 02 spots that patients will have to use at home after professional treatment. As you can see, it has very comfortable applicator, like roller, so they would use it just topically. Again, active ingredients including melanostatin 5, which will prevent the activity of the melanotropin, which will bind the receptors of the melanocyte, not letting any kind of hormones sit on that receptors. What would be the protocol of treatment? So of course we cleanse the skin, then we degrease the skin. So in the case of spot, I also prefer to degrease the skin with the gauze. So to have like a mechanical trauma, really, I do it to obtain, let's say, redness. After that, we will use step 1. So you take step 1 from the bottle, you need around from 0.1 to 0.5 milliliters. So start with 0.1, then you need a cotton swab, and you apply step 1 in several layers. You need to obtain frosting. Imagine you're applying one layer, you're obtaining frosting just from the one layer, and the whole spot is white. Then one layer is enough. So you obtain frosting, it's white, then you can do the second layer. But it will not be like that all the time. Sometimes we're applying one layer, we are not getting frosting, just maybe a bit redness, some spots, white spots. That's not enough. We need second layer. And you can do around up to 3 layers until you will get frosting. As soon as you will get frosting, you can apply step 2. And step 2, we need to apply like an application. So it should be a thick layer just on the spot. You apply it. Then after that, I usually put something for occlusion, like a transparent film, for example, in this area. And the time of exposure would be from 1 hour to 1.5 hours. So usually patients are going home, and at home they have to wash it off. After washing that off, they will apply MELINE Moist and Restore at home. Let's see protocol of application. So here is the spot. We need to cleanse the skin. After we degrease the skin, in the video, these steps are skipped. So then we are applying step 1. This is the first layer. And you will apply layers until you will not obtain frosting. In different patients, you will see different reactions. So someone have redness, burning sensations. For someone, they tell, I don't feel almost anything. So it depends. You already can see that we are obtaining some points of frosting. After getting frost, you apply second step. Here the application is with the cotton swab, but you can do it just with the spatula or with the finger, not to lose any product on cotton, because it will be a bit absorbed. So a thick layer. You are doing like such kind of application with a thick layer. Then I'm putting transparent film in that area, or something like this, 8-band. And the patient will remove it in 1 hour, 1 hour and a half at home. What kind of reaction we are expecting for? So normally, after such kind of treatment, of course, depending on the reaction of the skin, because here you can see that during the treatment, everything was very calm. There was no significant reaction of the skin. But for example, with this patient, I'm sure that the frosting was significant. So the depth of the penetration was really deep. It's possible that they will get like crusts like this, but not always they will have it. So here is important to explain, first of all, not to remove it by themselves. I mean, not to try to remove it. It should be removed by itself. But also a lot of patients will have just the exfoliation in this area. So of course, after such kind of application, you can see that after the crust was removed, we already see like the pink skin without any kind of hyperpigmentation. It's also possible that for some time, this spot would be more light than the other skin because we damaged some melanocytes. That's okay. Everything will regenerate, but in a couple of months. So it's possible that for some period, it will look like this, like a couple of months. For those who have just the exfoliation, normally you don't have this, effect, like you totally remove the hyperpigmentation. But for that, we have 0 to spots. So the patient will use that roller at home and it will stimulate the lightening process after the treatment. Normally, you will need 1 or 2 sessions of spots, not more. So you are just removing the hyperpigmentation, you are dealing with the melanocytes in this area by obtaining frosting, and actually that's all. So it's very fast treatment. In the same area, you will not need to do it again. Of course, it's possible that the patient will have some spots in other areas, but usually not in the same. The other types of the hyperpigmentation which we can work would be hyperpigmentation of the periorbital area. So in the periorbital area, we use another product. We use dark circles because the skin of the periorbital area is very delicate and we cannot work there with the same products as we are working in the other areas of the face. So we have dark circles, professional use, peeling, step 1 and step 2. And of course, we have 0 to dark circles, which the patient will use at home. So these are the main ingredients of the 0-1 dark circles. In the step 1, we have monofluoroacetic acid. and lactic acid. Monochloroacetic acid is the modification of trichloroacetic acid, but it's much more gentle because here we have less atoms of chlorine, so it's not so aggressive as TCA. In the step 2, we have phytic acid, ascorbic acid, and retinal. This is how we will do, or I will show you the protocol of treatment. Now let's see 0-2 dark circles, which patients will use at home. Again, here we have a roller, so it's very comfortable to use. I also always pay attention to these products, to this product, not only in the case of the treatment of hyperpigmentation caused by melanin, or not just after treatment with the professional peeling. Dark circles is the great product for those patients who had plastic surgery, for example, rhinoplastic. And when they have hyperpigmentation in the periorbital area, which is associated with another pigment, so usually it happens after bruising for really a long period, and bruising for a long period usually we have after plastic surgery, also during the rhinoplastics. So you know that there is a pigment in hemoglobin. That's why during the long period of the bruises it can stay. So it's not brown, it's usually bluish, let's say. And here we have not just lightning ingredients. Here we have Arnica montana extract, we have ginkgo biloba, troxyrutin, so venatonic active ingredients, ingredient for the stimulation of microcirculation, for the improvement of the quality of the capillaries. So it means that we will also work with the hyperpigmentation which is associated with the hemosiderin. That's why it's really great. It's recommended to use this product in the evening, not every day, but let's say day by day. One day is using, one day is not using. Of course, together with this product, we recommend to use eye revitalizer, some product for the hydration, because this product is not about hydration. This product is just about the treatment of hyperpigmentation with different kinds of pigments. But of course, we need something to moisturize the skin, because here we also have acids which will dry the skin a bit. That is why use it together with the eye revitalizer. The protocol of treatment. So it is recommended to do 4 sessions. Of course, again, we cleanse the skin. As for the degrees in solution, it's up to you. So we can use it, I usually gently use it, just not as active as for the other areas of the face, but just at least a bit. But of course, it's also possible not to use it because there are a lot of sebaceous glands in this area. The skin is usually dry. That's why after cleansing the periorbital area, we can start to use the first step, which we are applying with the help again of the cotton swab. So you just need a very small quantity of the product, around 0.3, 0.5, and you are applying that in the periorbital area, like 2-3 layers normally. Pay attention to the reaction of the skin. So if you have just after applying of this first layer, you have irritation, you have burning sensation, maybe the skin is very dry, maybe damaged, that would be enough. You can start to apply the second step. If everything is comfortable, you can do up to 3 layers. Step 1 doesn't depend on time of exposure. It depends on layers. If you want to be more active, do more layers. Like, don't wait an hour, couple of hours, it doesn't matter. Here, everything depends on the layers. So after the last layer, I'm just waiting for the skin to be dry, more or less. And after that, I can apply step 2. Again, we need very small quantity of step 2, and we will apply it in 1-2 layers. Again, depending on the reaction of the skin. And here, after the second layer, we have to wait for around 15 minutes. This is the average time. But sometimes you see that you're applying second layer. You can see even like the spots, small spots of frosting. You can see burning, erythema, and so on. Don't wait 15 minutes. Then a couple of minutes would be enough. Then you have to wash it off and to finish the treatment. So always you have like average protocols, but you have the patient near you and you have to evaluate the situation because you're a specialist who can decide if it's enough or not. It is recommended 4 sessions with 2 weeks interval, so like 15 days interval between the sessions. Here we can see the protocol. This is again the patient which is not reactive, so you will not see like burning or redness, but that is possible. We cleanse the skin. Of course, you can combine this peeling together with any other peeling. So you will do, for example, periorbital area with dark circles, and in the other areas, you can do any other peeling that can be Caucasian skin, or for example, you're working, I don't know, for any other peeling like Mandalay. No problem. It's just they should be applied in different areas, not to apply peeling in the area where the other peeling is already applied. And you can do like that. So we degrease the skin a bit, then I'm taking with the syringe some quantity of step 1, applying it with a cotton swab. The same with the second eye. So here, as I'm not getting any reaction, I'm doing second layer, I'm doing third layer, I'm waiting just for drying, and then I can apply several layers of the step 2. In the case you are getting redness, burning, and so on, then it's enough. You're going to the next step, applying minimum quantity of layers, don't wait too long, and wash it off. And again, after the professional treatment, the same like Caucasian skin, spots, dark circles, I recommend my patients to start to use 0-2, not earlier than 4 days. So we need some regeneration of the skin. We need to finish the active exfoliation. So for some that would be 4 days, for some that would be 1 week, not to have like irritation. So we finish the treatment again with Restore and Moist and protect the skin with BB cream or with our sun protection. And at home, patient will use 0-2 dark spots. You see, Moist is like is a serum, which we need for the effect of the occlusion to prevent transepidermal water loss, and the cream Restore we applied before because it penetrates it deeper. BB cream, light or medium. And the treatment is over. So these are some results that we achieved with dark circles. You can see really improvement, more light skin, more even skin tone. And the next professional treatment would be the treatment of intimate areas. For that purpose, we are going to use intimate. So what are mostly the areas where we are recommending to use that? Of course, this is mainly female patients with hyperpigmentation in the intimate areas, also inner side of the hips. Also, it can be the region somewhere under breast, for example. So actually, all the areas on the body which are prone to be traumatized, and because of that, there can be a hyperpigmentation. In that cases, we can use Intimate, which is really very gentle, but at the same time is very effective product. Sorry. So in the case of Intimate, it is recommended to do 4 treatments with 2 weeks interval. Peeling is really very gentle. So now I will try. Sorry, Intimate. Here we have mandelic acid, tranexamic acid, salicylic acid. So we are going to obtain anti-inflammatory effect, also to stimulate exfoliation in order to remove keratinocytes which are already dark, and to have some antioxidant effect. With Intimate 02, which is recommended for home use, here you can see really a lot of active ingredients. Again, with melanostatin 5, which will prevent the activation of the melanocyte and synthesis of melanin, which will be used after professional treatment. And the protocol of treatment is very easy. So we cleanse the skin, we degrease the skin of the area, and then we are applying, usually I apply several layers of Intimate into the affected area. I wait like the last, again, so everything will depend on the reaction of the skin. Normally, it's very, very gentle peeling and the patient feels very comfortable. But in the case, if they have some damages of the skin in that area, they can say that they have some burning sensations. That's why you will reduce the time of exposure of the last layer, and also you will not apply several layers. Mostly I'm applying like 2-3 layers, and after the last layer I'm waiting for up to 15 minutes depending on the reaction of the skin. After that we just rinse it with the water and finish with Restore or Moist. So normally that is very comfortable, and already after 2-3 days after professional treatments I recommend to start to use 02 Intimate. We use it once a day after shower, every day. Normally, everything is comfortable. Just in the case when the patient will say that they have like a, exfoliation, maybe some burning sensations while using 02 Intimate. Okay, don't recommend not to use it every day, like 4 times a week. But normally, everything is really very calm and gentle. By the way, this is also a good peeling in the case of hyperpigmentation in armpits. That's why you also can use it for that. Just in the case of the armpits, there are, of course, specific recommendations. So, for example, after these professional treatments, it's not recommended to use any antiperspirants like sprays with alcohol because it can cause a burn of this area. So we have to be very, very gentle. So here you can see that we apply it with a cotton swab in all the affected area where we have hyperpigmentation. Of course, it's better, usually there are questions about if patient has some laser epilation, then of course it's better to have interval between laser and this peeling for 2 weeks. and not to have any scratches, traumas in this area. That is why if the patient is shaving the area, it's better to do not during the day of the treatment, not the same day before. So after that, we wash it off. We finish the treatment with MELINE Moist and Restore, and just one of them. So it's very fast, very easy. Here are some results which can be achieved after 4 sessions of MELINE Intimate, but of course then supporting by 0 to MELINE Intimate. Any phototype you can treat because this is really very gentle product. So these were all the professional products which you can use for different types of the hyperpigmentation. Now let's see which additional products we have in order to finish the treatment, what our patient will use at home for the regeneration and moisturizing of the skin. And first of all, these are Moist and Restore. So pay attention. I've already mentioned you will have 01 Moist, 01 Restore, and you will have the same products which are 03 Moist and 03 Restore. The only difference is the quantity of product. This is professional. You have 250 milliliters, which you will use in clinic. And for home care, you have smaller sizes of the product. That is the only difference that we have in the products. So Moist, to use at home, is 03 Moist, which is recommended. It's like an occlusive serum, which prevents epidermal water loss. It contains hyaluronic acid and panthenol, so it will not penetrate really deeply. It will mostly stay superficially. That is why there is an option to use both Moist and Restore, or to use one of them. So for example, when we are working with a patient with the oily skin and they don't like creams because it can give you a bit be heavy, oily, and so on. So for these patients, we are mostly using Moist. But normally patients have or normal or dry skin. That is why in that case, of course, preferably you will use Restore. In the case of complete using of both products, the idea is that Restore is penetrating more deeply, hydrating, regenerating, and Moist stays more superficially. That's why we apply it after. Here you can see the active ingredients of Restore. So actually this is everything about hydration, improvement quality of skin, anti-inflammatory, antioxidant properties. Of course, it's more rich in ingredients. That is why mostly if we are using one product, that would be in the most cases Restore. Because it's a creamy texture and it's really very, very pleasant product. Actually, I'm using that not only to finish MELINE treatments. This is the great product to finish, let's say, any professional treatment because it soothes the skin, hydrates the skin, stimulates the regeneration. Really very, very gentle and soft product. Then the other products that the patient will use at home would be 04 BB cream. We have two, light and medium, and then SPF 30. So this is the products based on chemical filters. But also it contains some oil that will moisturize the skin, additionally protect the skin not just from the UV radiation, just from any pollutants. It's very nice for sensitive skin. So I'm sure that if you will try this product, you will love it and patients will love it. So actually they start to use it after the treatment of hyperpigmentation, and then they just buy it as a makeup because the color is very nice, because it doesn't have this mask effect. It's more or less transparent, but at the same time it's hiding some imperfections of the skin. That's why I really, really recommend you to try it. And the last product is 05 Pigment Home Mask. How are we going to use it? So I would say that Pigment Home Mask you will not need for all of your patients. This is mostly in the case of patients with severe deep hyperpigmentation, with the melasma, which the patient has for a lot of years, for example, or in the case of post-inflammatory hyperpigmentation that is usually dermal. So in this case, in order to improve the results which you already achieved with the help of Caucasian or ethnic skin, you will recommend to use 05 at home. It also contains acids, and you can see that the percentage is not very low. It's like 15% of mandelic, 10% of azelaic, phytic acid, and so on. That's why this is something that the patient will use at home once a week. So you already finished all your sessions of professional treatments. And your patient started to use home care or home treatment, that 02 that he will use for around 2 months. So already more or less in 1 month or after, they can start to use pigment mask once a week or once in 2 weeks, applying that all over the face. So the texture of the mask is again would be like pasta. So it's not like a cream. It's more solid, let's say. We are applying that in affected areas and avoiding periorbital area. The time of exposure depends. It can be from more or less 20 minutes to 1 hour. Again, I even sometimes, it's a product for home use, but I also use it professionally in clinic, especially for the first time. The patient is coming like to have a treatment with the professional lightening mask. So I'm applying that, I see the reaction of the skin, and I understand would for that patient be enough 20 minutes, or we can keep it for 1 hour. And after that, we are given like recommendations. So next time you will use it at home, you will do it for just for 30 minutes, and then you wash it off. And then you will reapply it in a week or in 2 weeks, depending on the reaction, because it's possible that patient will have some exfoliation, not significant, but still, of the face. But really, it will help like up to more or less 5 sessions with these masks are needed, or patient can use it during the whole year, just once a month, for example, to maintain the results of the professional treatment which you've got in clinic. Another I usually add that if you will pay attention to the active ingredients like azelaic acid, mandelic acid, salicylic acid, retinol, we understand that this is also a great product, not just for treatment of hyperpigmentation. This is the great product in the case of acne lesions. So for that type of patients, it's also a great product for home treatment. So you also can like some kind of recommendation. That was mainly our basic information about MELINE. If you have any questions, please write it in the chat. We will discuss it. When can be the patient use 02 after 01 peeling? It can be used not earlier than after 4 days, but sometimes even after a week, depending on the regeneration of the skin. If you still have some redness, the patient have redness of the skin, really significant exfoliation, then don't start to use 02 because it will promote even more exfoliation and irritation of the skin. So then I'm waiting for a week and we can start to use that. Can we use 02 already couple of weeks before having the 01 treatment? Yes, you can start to do that. And in that case, if you are starting to use 02 before 01 treatment, that will be like preparation of the skin for the professional treatment. So yeah, you can do that. How many can be used the home product and how to do protection from hyperpigmentation? If you're asking about 0 to, it has to be used not less than 2 months. And after 2 months, it doesn't mean that the patient will stop any kind of treatment of hyperpigmentation. You can just switch to more delicate products. Like, for example, we have pigment defense serum in Epigen, which is working more gently. As for the products for hydration, also that would be minimum for 2 months, and actually moist and restore. It can be used without any stop. So these are the products for hydration, regeneration, and so on. So it's okay if the patient will use it longer, no problem. As for how we protect with 04 BB creams with SPF 30. Is the ID treatment suitable with radiofrequency microneedling? You can use it together with radiofrequency, but my recommendation would be to use it after radiofrequency. So you already did the channels, let's say, for the penetration with the help of microneedling with the ref, and after that you are doing like an application of MELINE ID. That would be a great combination, because this is the prevention of any kind of post-traumatic hyperpigmentation, which is also always a risk with the radiofrequency. Can the dark circles treatment affect the color of micropigmentation pigment makeup of eyebrows? I assume the acids are stimulated cell renewal. Always when we are doing any kind of peelings, it's better to protect the skin in the areas of the micropigmentation. I mean, any tattoo or permanent makeup. It's better to prevent, because yes, first of all, we stimulate the renewal, then we have lightening effect. Of course, it's very difficult, like with the just with the dark circles, to remove that pigmentation, because it's deep, it's dermal hyperpigmentation. But still, with any peeling, you first apply some kind of cream to the areas that you want to protect. What is the time exposure for Caucasian 01 peel for chest and neck area? So for the neck area, it is also, let's say, for the chest, you need to have like half longevity as for the face. So I would say you can start with 15 minutes, and then next treatment, that would be up to 25. So the neck area is really very, very gentle, it's very thin. There are no big quantity of sebaceous glands. So the regeneration of this area goes slowly. That's why don't be too aggressive there. That is why usually the intervals are longer, not 2 weeks, but months. If for the face we can do it for 2 weeks interval, with the neck, no. And the same with the time of exposure, it should be lower. So start with the 15 minutes. Does high doses of thyroid therapy affect the effectiveness of the treatment? Actually, the effectiveness of the treatment will affect mostly the problem, the metabolic problems which are associated with the hyper or hypoactivity of the thyroid gland. That is why in any case of any autoimmune disease, sometimes we are not obtaining the results for which we are looking for, just because of the metabolic disbalance. Guidelines around 01 peels and laser therapy for hyperpigmentation. First of all, I would say that if you're working with the lasers for the treatment of hyperpigmentation, for you it would be great to work with the product 02 and 03, which patient will be using after your professional treatment in order to prevent any kind of hyperpigmentation after that kind of treatment, because it's rather aggressive. It's very effective, but still. Then MELINE ID would be a great combination. So after any laser treatment, you even can topically apply 01 for the on the skin. As for the peelings, I like, in order not to overstimulate melanocytes, I would recommend you to do interval between the sessions. So in the case of treatment with the laser, the interval, if you are gonna use also 01, there should be an interval not less than 2 weeks. When we can repeat usage of day home cream after 2 months of active usage? 2 months is the minimum time of active usage. So if after 2 months your patient is comfortable of using that, they can continue using that, and they can continue using that up to 6 months. Then I usually switch off to some more delicate products like pigment defense serum, for example, that can be like dark spot eraser in aesthetics, or using day home care not so often. Let's say they can use it during the whole year, but like once a week, for example. But to tell the truth, most of the patients, when they stop this, when they finish this 2 months therapy, the product which they would like to keep in their home treatment would be night, because night really is great for the quality of skin, for the anti-aging effect also. That's why night is also mostly for preventing of hyperpigmentation. Day is mostly to remove the hyperpigmentation which the patient already has. But in the case you want to continue using, then you can use it up to 6 months in really like active regimen, or once, twice a week during whole year. Some customers absolutely do not tolerate the restore or moist after the peeling. Well, it's a question why they do not tolerate, what they don't like, because as I've already mentioned, these are products which I really love, not only after MELINE treatments. I use them also for other kind of treatments. That's why I don't know what is the reason here about intolerance, but for example, you can substitute it to in skin repair. Which peel would be better for the chest area? For the chest area, if you are talking about the décolleté area, when you want to improve the quality of skin, to work with the wrinkles and so on, that would be better Caucasian, in MELINE Caucasian Skin 01. It will work with the hyperpigmentation, and together with that, it will also significantly improve the quality of skin. If people absolutely cannot use day and night regularly, minimum number of the days. Minimum number of the days, it's difficult to say when it's recommended like at least 4 times, but let's imagine that your patient have extremely sensitive skin. She cannot use any acids and so on. So my recommendation would be not less than 2 days of using MELINE 02, but you have to add something else, like more soft. And my recommendation was to add pigment defense serum from Epigen line of Inno between the using of MELINE day and night. Can we do deep microneedling with 01 ID? Yes, you can do deep microneedling, no problem. I do that for mesotherapy, for example. I like it. Mm, you just have to keep in mind that we have their tranexamic acid and also ascorbic acid, so the pH of the product is rather low. That is why it's possible that there would be some redness, a bit of burning sensations during the treatment with MELINE ID, but that's totally okay. So don't worry about that. That's the normal reaction of the skin. Okay, I guess these were all of questions. If you have any other questions, you always can write it to Skin Academy, and or you can get in touch with your distributor in your country, because we are in contact with all of the distributors and we can provide all needed information that you need. So thank you very much for your time. I hope you've got some really useful information. I'm sure you will really love the results which are you gonna have. This is one of the most popular and effective products in the world, that I can tell you for sure, because I'm traveling a lot doing trainings for that, and I've seen significant and really amazing results of the doctors all over the world. Sunny countries, cold countries, everywhere. So you also can be the member of this MELINE family and also share with us your results. Thank you very much and see you soon on our next webinars. Bye bye.